I was on the golf course with my colleagues, and later that day I passed out. I was admitted into the Red Deer Hospital and found out the next morning that I had leukemia, transferred by ambulance to Tom Baker. And the day following, had a central line inserted into my chest and started chemotherapy right after that. I'm a 3-time leukemia survivor. 17 years ago, I was diagnosed with acute leukemia, and then I underwent lots of chemo and radiation and various other treatments and had various complications over that 17-year period. I had 2 relapses, unfortunately, as well, and underwent 3 bone marrow transplants or stem cell transplants. I'm really happy to say that it's been 6 years since my last transplant, and I'm living a very good quality of life. I wouldn't be here if the doctors at Tom Baker hadn't worked with the doctors in New York and pushed forward a very challenging idea of 2 centers collaborating together and getting drug companies to approve the idea of having a 3rd transplant, which really doesn't happen almost never. In fact, I think I'm the only person in North America who's had 3 bone marrow transplants and is alive. So I think, you know, the collaboration of those doctors working together and then Health Canada approving an unprecedented trial with experimental chemotherapy, that's quite miraculous in itself, because it had to get done before I relapsed. I was appointed to the Provincial Advisory Council for Cancer before the SCN was set up, and it was through that connection that I got onto the SCN, which to me was a perfect opportunity. Because as I see it, you know, the SCN's trying to transform cancer care, and the team of people that are involved are just amazing. They're all passionate about making it better for patients, and how do we do that? And for me to be on that core committee with them as a patient voice to help guide that, it makes me feel like I'm contributing to having less people go through this. And if they do, that it's a smoother journey. I think maybe being part of the team, alongside, you know, mostly physicians and health professionals, allows them to keep focused on the patient and their families to ensure that the improvements we're suggesting are for the benefit of the patient and their families. So I think for anyone who's had any type of experience with cancer, being involved with something like the SCN is just an excellent way to not only help others, but also to put those darker days behind the brighter ones.